Hello medical coders, there's a huge announcement in the AAPC regarding the AAPC exams from 2024. So if you are planning to write AAPC exam, either CPC or any other certification in 2024, so this update is for you. AAPC has announced from 2024 they will be including fill in the blanks questions as well in all AAPC exams. Yes, you heard me right. So far there are 100 questions and all these 100 questions in CPC are multiple choice questions, right? You know that already. So from 2024 there's going to be a slight change. There will be fill in the blanks questions also. So the first question what comes into your mind, will it be difficult, Surya? It should not be difficult if you have prepared well. If you have really prepared well, fill in the blanks or multiple choice question will not be a big issue for you because you are well prepared. If you're not well prepared, then that will be a hindrance, because if you really know which section has this kind of procedure, for example, if they're talking about an E&M, you know where is E&M section is, then it is not a big deal for you. If you really prepared well, then fill in the blanks is not a big deal. But if you haven't prepared well and you have no idea or you have knowledge of searching codes all by yourself, this might be a small problem, but you can overcome this if you practice really well. So the second question that will come in mind is, are all 100 questions will be fill in the blanks question? No, that is not the case here. Then it is really difficult for you all. If it's all, just imagine if all 100 questions are fill in the blank questions, that 4 hours will not be enough for everyone. It is not all fill in the blank question. It is a hybrid of questions. You will have multiple choice questions as well along with that fill in the blanks questions. So I think in the beginning the ratio will be very less for fill in the blank questions because they just introduce that one. That is my judgment. I don't know exactly. Practically thinking, they will not introduce 50% of fill in the blanks and 50% of multiple choice question in the beginning at least. So the third question is how to prepare to combat the situation. Should know the number series well. That is, for example, 7 series is radiology, 8 series is pathology. Like that, you should know the series well and should know the pattern of each chapters. For example, how the surgery will start. Like in everything, in all the things, surgery will start with an incision, then excision, like that. You should know all these patterns. If you know the patterns, it will be easy for you to pick the answers for the fill in the blank questions. Then the second preparation here is you should go through the book several times. I encourage all the medical coding students, minimum you should have gone through the CPT book 2 to 3 times. Minimum 2 to 3 times you should have gone through from cover to cover. You should have just gone through all the codes, all the footnotes, all the instruction guidelines that is provided in the book. Then only you'll have that idea like where to find code and which kind of procedure is located in which area of the book. So you will have that idea. To get that idea, you should go through the book completely, like minimum 2 times. The third tip is practice more mock tests. And when you're practicing for mock tests, practice as if there is no multiple choice options, because I know like all the coders who are going to appear for the exam in 2024, you will not have idea about the fill in the blanks, but you will have the old mock question papers, right? So those mock question papers, treat all those multiple choice questions as fill in the blanks. If you read and practice like this, then fill in the blanks is not a big deal for you. So practice well for the exam in 2024 and crack it in the first go. All the best. For more such updates, don't forget to subscribe and hit the notification icon. This is Surya Johnson, your medical coding guide.